So thank you all for being here today. I'm not sure what to say after that video. It's pretty powerful, right? Hopefully it gives you a sense of what patients are experiencing every day. You hear a number of us talk, you hear data coming across the wire, but there's nothing like hearing from the patients exactly what they're experiencing. So I want to just take a moment to thank all of those, and we have some in the room with us today for sharing their experience with us. So I am not Kim Thibodeau. I know you're expecting to hear from her today, but I am a reasonable facsimile of Kim. At least I hope so on a good day. So Kim is under the weather, and she sends her best. It's really hard for her not to be here. There are a number of her friends in the room, and she really wanted to be here, as you saw, this really powerful project, and she does send her best. So I'll send her your wishes as well. So I'm trying to get this video to close out, and it will not let me do that. So if there's someone in the room who can help me with that, I would really appreciate it. So let me just take a minute, and I'm going to go over a couple of logistics with us today. So you will be fed, right? You're at a cancer support community event, which means that between Kim being from Philly and me being a Midwesterner, you will be fed. So in the course of the day, we will be bringing you lunch. The ladies' room and the gentlemen's room is right outside the door. We will hear from a number of different voices today, and we hope that you will engage lively in that conversation. We're waiting for Dr. Mark Mcclellan to be here any minute, and we're looking forward to that. And Dr. Joanne Bazaglo is here. We've got the cancer support community team who works so diligently on this project here as well. So we're happy to answer any questions and talk about next steps moving forward with this particular project. And so I've had a number of questions of late saying, why did you do this project? What was really the goal of it? What were the plans of it? Why did you do this project? And you know, the answer is pretty simple. We get caught up in data, and we really wanted to present to you the patient voice. We really wanted to elevate the patient voice in a way that was meaningful. And we know that so many of you are having conversations with policymakers. So many of you are on the Hill every day. You're talking to insurance companies. You have the power to make a difference for people who are touched by cancer and who are facing the future. So what we did was we went to the streets, and we went to the streets. So those are real patients being seen in our affiliates today, yesterday, tomorrow, to really understand and get that voice. So there will be a couple of pieces for you. You will get a copy of the report on your way out. You will also get a copy of this video. I have plenty of copies for you to have, as many as you would like to have. So if you feel like they would be helpful in your conversations with policymakers, please just drop us an email, and we will get you as many copies as you feel would be helpful to you. So what you're going to see is a snapshot of the data. We have a lot more, and again, we're happy to share that with you and continue to mine it, but it really is a snapshot of what's happening today. So when you're hearing, are people making decisions on the marketplaces that they're not quite sure about? Are the decisions or the effects of the Affordable Care Act bleeding into Medicare, Medicaid, private payers? We're going to give you some of those answers today that you'll see in the data. What about psychosocial care, which is near and dear to our heart? There's a statistic you're going to see later. I'm not going to steal Joanne's thunder, although I really want to. That is startling. And it's startling for me because I know that the collective we, have the solutions that when offered to patients can really help. So kind of keep that in your mind as you're listening to Joanne speak today. So I really want to welcome you, again, on behalf of Kim and the rest of the team. And I really, I have to start the morning out in a way that I think is meaningful for all of us, okay? So we heard Regina. She was a very key part of the program. And Regina is a very, very special person. She's from my home affiliate in Indianapolis. So I've gotten to see some of the work that she's done in the city, the commitment that she's had to cancer and making things better for people with cancer, and the friendships that she's formed with folks in the affiliate. And we lost Regina. Tomorrow will be 2 weeks since we've lost Regina. And I really just wanted to start today off with the dedication to her, a tribute to her and all that she's given. We keep her family in our prayers every day, and if we could just have a moment of silence for Regina, I would appreciate that. Thank you. So let me offer thanks to the people in this room. So there are so many of you who are our advocate partners, and we could not do the work without the support of you. We love our partnership with you and really feel like we're moving the needle to help patients like Regina and the others that you'll hear from today. We thank those of you who are working in industry to create solutions and bring solutions to patients to improve this process. I have to say thank you to the Csc staff, who's incredible. We've got Joanne and Gwen and Anna and Rob's back there someplace. We've got a good number of the staff, so I have to say thank you to you as well. And then thank you especially to Vital Options International, an advocacy partner from LA. They've traveled here today to videotape this, and they will be helping us disseminate some of the findings in a broader fashion. And then finally to our sponsors. So a number of you have jumped in with the work that we're doing at the Policy Institute, either as a founding sponsor or as a sustaining sponsor. And then we've had 5 companies who have really stepped up around this Access to Care project and has really helped us bring not only this to you today, but to bring the solutions to you as you're having conversations with lawmakers. So those people are Amgen, Bristol Myers Squibb, Lilly Oncology, Genentech, and Novartis. So a special thank you to you. So what we're going to do is just take a quick break. I know that we've had a chance to socialize a little bit. We're going to take just a quick break while we're waiting for Dr. Mcclellan to get here, which should be any minute, and we'll get his slides loaded up and started. Lois.
I just wanted to ask a question whether or not the voter report video will be online and whether or not you'll create vignettes from the video.
Yep, so they are online right now. They all went live at 11 o'clock this morning. Yep, so they are online. And again, use it freely, however you would like to. Okay? All right, so we'll take a quick break. We'll call you back as soon as he gets here, and we'll get started. Dr. Mcclellan is in the building. So we'll get started with the rest of our program. So thank you all for enduring our little bit of a break, and I hope that you had a chance. I always say that we never have enough time to talk with each other, so we sort of really planned that and gave you plenty of time to talk with each other, so make sure you mark that on your evaluation form. So a person who really needs no introduction, I'm going to try to do a brief introduction. Dr. Mark Mcclellan is a senior fellow and director of the Healthcare Innovation and Value Initiative at the Brookings Institution. Within Brookings, his work focuses on promoting quality and value in patient-centered healthcare. Don't we love him just for doing that work? So a doctor and economist by training, he also has a highly distinguished record, as you all know, of public service and in academic research. He's a former administrator of CMS, which we also love, former commissioner of the FDA, we also love that, where he developed and implemented major reforms in health policy. And as you know, we're all continuing to try to move the FDA or work with the FDA to become even more patient-centered. So I'm sure Dr. Mcclellan would be happy to help us in that endeavor. So he's a previous member of the President's Council of Economic Advisors, Senior Director of Healthcare Policy of the White House, on and on and on and on. So we are so fortunate to have a little bit of his time here today. And let me welcome to the stage, and if you'll help me welcome him, Dr. Mark Mcclellan.